Hey, this is Gerardo, Phorma Medical CEO. In this video, you will watch an interview with a patient, John Baker, and he's a patient that has received stem cells in a joint, in IV, and he has improved his quality of life. In this video, you will see an interview as person to person. How is the procedure done with Phorma Medical? What recommendations do you need before and after the procedure? Which cares, what to expect, and what else do you think is gonna happen?
Well, you just got to do what he says.
Yeah.
Just do everything he tells you, and you'll be good.
So if you are interested in getting some stem cells, or you want to improve your quality of life and you don't know how to do, this video is for you. Hey, hi, this is Gerardo, Phorma Medical CEO, and today we're gonna make a special video for you so you can see a perspective from a patient since day zero or the first touch until 1 year or 2 years after the procedure. So you can see a testimonial from the beginning, how it worked in the meantime, and how it ends in 1 year later and 2 years later, like it's the case of this patient. And today we have John. John, nice to having you here again.
It's good to be here, Gerardo. Good to see you again.
Good to see you again.
Yeah.
Yeah. Well, can you tell us your name, your age, and where you're from?
Well, I can tell you my name. In Espanol, it's Pelón or Maestro Limpio, but in English it's John Becker, and I'm from Franklin, North Carolina. And I ran into Gerardo kind of by accident because in the States I was having major problems with my shoulders and my knees, and I had a section in my back that was bad, and,
The L5.
L5, and so I went to a lot of therapy in the United States, and I was told by the doctor that I really should get stem cell therapy, but that in the United States there's legal things that are in place there that they're not allowed to give you enough to make a difference. And so the therapist recommended that I go to Bogota or Mexico, and that was my first introduction to medical tourism. And so I started hunting around, and I found a couple places in Tijuana, and when I made contact, I wasn't real crazy about the response. So that's when I ran into you, and it was like that. It was like everything was, you were right on top of it, and I really liked that. And so I made arrangements to, come and get stem cell therapy. And a lot of my friends were like saying, well, that's not good because, it comes from abortions, and it's probably not ethical to do. And that's not the case at all, because the stem cells that Gerardo's company gets are mesenchymal stem cells, and they come from the umbilical cords of live births, where the mother's healthy. It's just it's the amniotic fluid and the things that come from the umbilical cord that's normally thrown away, and then they discover that it's rich.
Or many people pay a lot of thousands of dollars per year to preserve their cord blood, but in the end it's like the frozen food. A lot of time they will not work. They
Right.
will lose their efficiency.
Right.
And what we do is collect some cord bloods from newer babies that are already born, and we using everything fresh. So, like for example, in your case, you make the deposit to secure the date, and that day that you make the deposit, we start working. To collect the cord blood.
Right.
We make the STD test, all the screen, cancer, bacteria, coronavirus, and all of that stuff, and they test negative, so we can produce it and we can do the stem cells. So when you arrive, the same day that you arrive, the stem cells arrive finished. So everything was really, really fresh.
Yeah. And I've noticed too, like when we were done with the procedure, I've got certificates for the sanitation of the stem cells, and it was really awesome to see, because you could see that, and it was a third party lab that does that, so that was good. But just just so that you know, if you're listening and you're in the United States, this is a great place to come to get this done, because you can get volumes of stem cells, and stem cells are basically regenerative therapy. So my problem, I mean, when I got here, I couldn't even reach over here to pick up this cup. I couldn't do that. And so when we did the therapy and I got the stem cells right into my shoulder joints and stuff, that all changed. And I went back to the orthopedic in Franklin, North Carolina, and showed them, that I had just full range of motion now, without surgery, which was awesome. And then I had it in my back as well, which helped, and I got it in both shoulders and in both knees. So then I got an appointment here. Gerardo got me set up with a dental office to get some work done on my teeth, and it just turned out so great. I mean, first of all, like coming from North Carolina, never being here before, it was a breeze, because when I got to the airport, Gerardo had a photograph of the driver and the car that was picking me up. I mean, it was just like seamless, and I was treated so well. And then went to this beautiful hotel called Quartz Hotel, and I'm telling you, there's stuff in New York that doesn't even compare to it. It's so beautiful and so nice, and everything was great. And so he took me to the dental place, and I ended up. I will tell you, I got like 19 crowns, new crowns, and the reason why I did it here is because in Franklin, one crown was $2,300, and here it was $595. So it's worth the trip. And the work is phenomenal. Look at this face. I mean, those teeth look good, and I'm just real happy with it. And the people were just so nice. I mean, if you're not familiar with the Mexican culture, I mean, these people are just so kind and sweet, and I just love them. And my experience coming here has just been phenomenally good. I have no zeros. It's a 5-star review from me.
Yeah, can you explain a little bit about our stress-free experience that you live with us since the first touch? Like, how was your first touch with us? How was your, I don't know, phone call or email? And then how's the process?
Yeah, well, my first touch with Gerardo was by email. And I just sent him an email. I saw a little bit online about him. Sent him an email, but like I said, right away he responded, and so we talked back and forth, and he speaks great English, and he writes actually better English than he speaks. And I thought, well, this is great, because I can understand everything. And then when I got here, it was just perfect, because he took me every place that I needed to go, made sure I didn't have to think about anything. So, it worked out really good for me. And, I'm 75 years old now, so I'm not as agile as I used to be when I was his age. So I'm trying to keep up with him, what I'm saying? He's fun to tag along with, and he's taken me around and shown me a lot of good things in the town. But again, the medical experience was just like top notch.
Well, you mentioned that you took some shots in your first session, right? The shoulders, knees, spine. Did you have any pain on the doses, on the infiltrations, or what did you think? And at the end, when you get the procedure, was easier what you thought? Because many patients have this question. Okay, what are you gonna do to me? Are you gonna put me a big needle, or are you gonna put me a small needle, or do I need anesthesia? Do I need something? Well, in his case, particularly, he got L5 shot, what I can say, and he got anesthesia. But the second time that you came and you put some in your shoulders, you didn't need anesthesia, right?
No, like the first time I was here, they had to do an epidural to do my spine, so. I was awake for the whole procedure, but I never felt anything anywhere. So, second time, I got, I think I did the shoulders again. I can't remember exactly, but no, I've never felt any discomfort in receiving the stem cells at all.
Well, when you get your first shot, Uh, how when you get your first shot, how many time it lasts the procedure, and after the procedure, how many time did you start to feel the benefits?
Well, that's a good question because I forgot to say that on my first time here, I also got an IV,
Mm-hmm.
which was I think 100 million
Stem
stem cell
cells.
IV, and I will tell you that I had an instant response to that because I was having neuropathy in my feet, where my feet were super numb and painful, and within a day that was gone. I mean, when I got home, I was walking normal.
Yeah.
So
Yeah.
that part was instantaneous. As far as my shoulders and everything go, it was. I could tell, within a couple of weeks that things had happened because, first of all, there was fluid in there, which I must have been dry. I don't know. I'm not an orthopedic, but within a few weeks, I was back in the gym right away. You've probably seen maybe some of the videos that I did while I was in the gym because I started pulling the rubber bands and doing stuff, and I could not do that when I came here. So that all happened within 3 weeks or so.
Sure, it's important to mention that when you get some stem cells applied in your shoulders or knees, you need to wait at least 2 weeks of no gym, no nothing. You can do your normal life like walking and stuff
Yeah.
like that, but no heavy lifting, no gym, no exercise that takes or have high impact. So yes, really important to avoid this exercise for 2 weeks.
Yeah.
No alcohol, no drugs, no marijuana. In the case of John, he doesn't consume anything of this, and he has a really good diet. So I remember John that got diet, and he was overweight because you mentioned that you couldn't walk. You just can't. Um, you couldn't walk like more than an hour a day. You just walk like 15 minutes, right?
Yeah, I used to walk a lot, but my knees got so bad that it was, holding me up. I couldn't do anything.
Yeah, I remember that, and I remember your L5 that you got a lot of pain and neuropathy in your L5
Yeah.
that went direct to your feet. That stopped you from walking. From you want to you were just laying in bed like the whole day, right?
Yeah, it's pretty rough because the L5 there was some damage there and it crushed my disc and stuff. And so what would happen is when I'd stand up for any prolonged period of time, like 10, 15 minutes, my leg would fall asleep. It was bad. That's one of the reasons why I started to look for help, because I actually fell because I couldn't feel my leg. And when I got the L5, and I've done that twice. I've done the treatment twice.
Yeah, twice.
And I did the L5, and that's changed. Is it perfect? No, but it's 1,000% better than it was.
Yeah, it's important to mention all the people interested in the procedure. This will not, well, obviously, if you are a person over 40 years, you will not feel your body again like you were 15. It's important to be like a realistic, right?
Yeah.
But you will improve maybe 5, 10 years. That's what most of the patients mention. In your case, John, how many years like you felt younger,
Well,
approximately?
it's hard to say, because when I look in the mirror and I see this face, I'm going. I mean, honestly, I don't feel like I look like
Yeah.
other
That's good.
people that are 75, but that's just my problem. It's me looking out for my eyes. But I think honestly, I just feel so much better because, like I said, I see people my age and they're not getting around good. They're shuffling their feet. They're in wheelchairs, or, and I'm walking 2-3 miles a day, no problem. Doing gym, and I'm just happy.
Yeah, and it's important to mention, for example, he's doing gym, but he's taking his in control. He's not doing a lot of bench press, a lot of that. You're doing a lot of aerobics, normal things that keep you healthy, not being like a really big guy, right?
Yeah,
That's
yeah.
important
No,
to
I'm
mention.
not. I'm not. I used to bodybuild and stuff like that, but I don't do that anymore. Now most of the regime I do is I use the resistance bands because it's low impact
Yeah,
and it's
exactly.
easy. I do stuff that's conducive to strengthening my knees. I do all the shoulder stuff that's like when you have arthritis inside your joints and stuff, you can't really do the exercises. So what happens is your rotator cuff, all your stuff starts to deteriorate. And so now I can do all that without any problem, and everything works good. So I'm pretty happy about it. I'm doing the same exercises that I did when I was doing bodybuilding, but just with way less weights.
Exactly.
I don't need it.
Yeah.
I've been there before.
Yeah, it's important to be active after these 2 weeks, so your body can heal better. You will be a happier person for sure. You need to be active. It's important to be active because part of this regeneration is to have your body active.
Yeah.
So it's important to do exercise, having a healthy diet, avoiding like soft drinks, high concentrated sugars like
stay away
sodas.
from Mexican food.
Cakes.
That's all you gotta do. No chips. Get away from the cheese.
Yeah, you can, but you need to be like controlled.
Yeah, it's like you just everything in moderation.
Yeah, because like everything, must be moderated, and that's like the key. To have the best recovery. Also, once you perform your procedure, we will share with you a list of what you can do, what you can't do, what you must not do, and also what to avoid 100%. And this file we will send to you before you arrive. Why? Because we need to prepare your body to be in optimized condition to receive stem cells. What it is again, avoiding alcohol, drugs, marijuana, Tylenol, ibuprofen for at least 5 days. If you have any medication, you can share with us. Our medical and scientific team will determine if it's necessary to stop the medication or not. Most of the cases, you can continue your normal drugs with the procedure because it has no contraindication. Just the thing that we mentioned before, but yeah, that's it. People, it's really friendly. We have helped a lot of people with kidney disease, with lung disease, with arthritis, and most of these diseases, they have one thing in common: that their immune system is not balanced. Right? In your case, your
immune system.
Immune system, is not balanced, and in your case, your immune system was attacking your cartilage, right?
Yeah.
So what we do is we make a special protocol deciding for you. In your case, your protocol will be just deciding for you. John's protocol is just deciding for John, and my protocol is just deciding for me. So we don't think that one protocol fits for all. So or your protocol will only fit for you, and if you follow all the protocol, your benefits will be better. It will be the best.
I know when I got home, my wife said, when we went to sleep, she was like, "Wow, your breathing has totally changed." Because stem cells, they like the lungs,
Yes.
So as soon as I got home, it was like I was breathing much better. Everything changed, It was really good. So I just really recommend that you do it. And when he's talking about the protocol, for the personal protocol, you just give him all the information that he asked for, and then they put this program together for you. So you really should do it because it's gonna extend your life. And I think if you've seen some of the promo, you see Mel Gibson came down here, brought his dad. He was like 94 years old, crippled in a wheelchair, and he got stem cell therapy, and it's like a different man.
Yeah.
So you really deserve to do that thing. And again, the whole thing about stem cells is it's regenerative therapy. So that makes, what it does is it goes to the places in you. If you go to site-specific places like I did with the shoulders and knees and my back, that's one thing. But it regenerates the deteriorated material there. The stem cells take on the form of the cells that they attach to. It's my understanding of it. But I would recommend too that if you have site-specific stem cells that you're going to get in your protocol, he's going to recommend that you get an IV too, and that's awesome because the IV it's like sending hunting dogs out into your body. They
Yeah.
go everywhere. They find out where all this stuff is, and you know, you just overall improve big time.
Sure, and that's important because we as humans we think that like everything, right? If there's a problem in A, you need to go to A, right? But there's a lot of factors in your body that they have A to C and double C, right? So when you get your IV and then we mix it with the direct joint injection, your body will be ready to regenerate, and also this will be regenerating by itself. So first, the cause of the problem, that in most of the cases is arthritis or osteoarthritis in patients like you with shoulder problems, is that the immune system is unbalanced. So we need to balance. We need to stop your body to attack itself and need to regenerate, right?
Right.
So first we want to balance with the special serum that we have, that we made in the laboratory. No, we don't buy it in some pharmacy drugstores. So we do it by ourselves, and it's optimized for you to get your immune system balanced, and not your immune, you also your endocrine system, your nervous system, all the systems. So you will be feeling too much better and calm. You'll be a more calm person. So if you're so rushy, you will be calm and you will see the things better. That's patient like you said, right? I have better mental clarity, so I have to take really important and serious decisions. So now I can take it with better, with a better panorama, right? That's it.
Yeah. It's sort of like it's like having an automobile that you bought brand new, and you never did the transmission service on it. Next thing you know, the transmission's slipping, things not working, and that causes a systemic problem. Other things start breaking down. You didn't take care of it. So stem cells for you would be like a last ditch effort to make up for not taking great care of yourself in the first place.
Yeah, and for example, another case that we have is that we perform our procedures in a hospital. This is really important. Why? Because most of the places they perform it in clinics, right? So we perform in a hospital. Why? First, because we take care of you since the first touch, and it's really important to have a hospital. Why? Because we have ICU, we have special nurses from emergencies and normal nurses. We also have orthopedists that perform the procedure, doctors that see you doing everything. And this is really important because in the case of emergency, we don't need to call an ambulance. We can act by itself. And an emergency doesn't mean that have a side effect of stem cells. No, we don't know what's going to happen in day to day, right? So we're just ready in case we need to act. So you're always gonna be safe. You're gonna be this best hospital, one of the best hospitals in Mexico. You can talk about the hospital. It's brand new. It's pretty. It's
super beautiful and nice staff. Everything's awesome.
Yeah. So we focus our procedures in human quality, right? We know that you're not just a patient, you're a human, and you deserve the attention that you deserve, the highest quality, the best human trait. And we compare, I don't know, you can talk about it, that we compare our procedures not like a doctor, like a visit to the doctor. We compare like going to a spa. It's a really professional, but it's a really friendly environment. So you don't need to wait like long period of time there. You don't need to see bad faces. You will never see a bad face.
That's right.
So we are gonna be always really human touch. We believe that one patient at a time is the best. Why? Because we just focus on you. You're the rock star. You're everything. So our objective is to you get improved.
Yeah, and that's the experience I had. It was awesome. So. Yeah, I really appreciate it, and that's why I've come back. This is what, my fourth time back.
Yes.
The two of the times was coming from my teeth, but again, that experience was again systemically across the board. Excellent experience, and those doctors over there were just fantastic and just completely redid my mouth. And again, that's another thing. It's like a whole lifetime of not taking care of things when they should have been, and now I'm back. See. I'm back.
Yeah, and also And most of the people is watching this video, they're from the States, and we're in Tijuana, Mexico. Uh, we know that what you hear in news, and what do you talk about that?
Well, it's like a friend of mine said, after 9/11, he said, I was invited to go to the Philippines and I was worried about it. He goes, listen, you're not even safe in your own Pentagon. And, but uh, you can find trouble anywhere you want to.
Mm-hmm.
So, just look at the news in the U.S., all the city. I mean, look what President Trump's doing in D.C. And this place is a whole lot safer than that. I mean, I could walk around outside and not feel, any problem, especially in the area where the hotel is. It's beautiful. And if that doesn't convince you, the hotel has a food court down below. There's no reason to leave the grounds, and the food is fantastic. So
Also, we have hotel in the hospital, so if you just want to make your recovery travel, we can pick you up San Diego's airport. We can drop you off at the hospital. The hospital has hotel for you and a companion. The hotel has also the hospital has all the services. Also, we have in the hospital restaurant, so you don't need nothing.
yeah,
We have experts in the same place. We have a pool for recovery. We
yeah,
have a physiotherapist. We have facials. We have all you need is
yeah.
in one place. So you can stay in the hotel or you can stay in the hospital, and both places are in the safest area of the city. And I can say like Tijuana is like all the cities in the world. There's good places and there's bad places. And me as a Tijuana native, I have never been to those bad places, right? So
Right.
nothing has happened to me. Nothing has happened as John as
Yeah.
a U.S. Patient, and this is really safe. And we it's part of our stress-free experience, right? To be in Tijuana like a local, and it's really normal. Also, it's really important to mention that it's really common to see American people in Tijuana. This is a border city, so there is like metropolitan area between Tijuana and San Diego. So it's really common to see American plates from California, from Arizona, from Utah. So if you want to drive by yourself, it's also valid. Many people drive by themselves and they take advantage and they go to Rosarito, to the beach, to stay a week. So they take advantage of their trip to have medical
Hmm.
procedures and then go to the beach or go to the vineyards right
Yeah.
here.
You can do all that stuff. It's seamless. Um, when I've been waiting at the dental office, I've met a lot of people from all over the United States that drive here.
Yep.
And you can fly right into Tijuana if you want, or you can go into San Diego. It's only about 20 miles from here, and they pick you up, so you're here in just a few minutes. So it's very convenient. Whatever you want to do, it's super convenient to make it happen for you, and you just really need to just get up off that thing and make it happen.
Sure, so it's your own choice. So if you want to travel to San Diego's airport, you want to travel driving to Tijuana, you want to travel to Mexico City and then to Tijuana. And yeah, so there's a lot of ways to come here with us. And you don't need to stay a night, right? There are many patients that they, well, not your case, John, but there haven't been many patients that they arrive to San Diego's airport at 9 a.m. We pick them up, we bring them to the hospital, and they perform their procedure and they can go back to their city in
Same.
a flight after 6 p.m.
Right.
So they didn't stay a night even in Tijuana, right? So there are many people that they are really busy as you or you, and they don't have time to spend a night maybe in Tijuana, right? But they really want the procedure. So they say, hey, Gerardo, I want to go tomorrow, and tomorrow I'm leaving. Okay, that's fair. We don't need that much time to. You don't need to even stay.
Right.
So if there is a special condition that we will look in your medical file that you will share with us, we will let you know like, hey, you know what, John or Gerardo, uh, do you are a special patient, you have this condition, yes, you must stay, but you will let you know in advance. It won't be not like the same day, right?
Yeah. And the procedure doesn't take long at all anyway.
Mm-hmm.
So Unless you're getting something done in your back and you have to have anesthesia or something like that. That takes a little bit longer, but still, even then,
Yep.
it was I think it was less than 45 minutes. So
Yeah, you're staying in the hospital for like 3 hours, so
Yeah.
with the anesthesia, so yeah, it's really really fast.
yeah, no
And
problem.
the IV lasts like 40 minutes. If you have renal failure, it will last like 1 hour and a half. You cannot take liquids really fast due to the condition, right?
Right.
But yeah, we have seen patients that have improved a lot in less than 3 months. For example, your case was less than a month. Then you improve a lot from arthritis, and your life changed drastically in less than a month, right?
Yeah, big time.
And what you can say to these people, or for the people that they don't believe that it's impossible to improve a lot, you know, and I have tried medications for 10, 20, 30 years, and this is impossible to improve me in less than a month.
Well, I mean, I understand that if that's what you're thinking about, but I mean, if you do any kind of investigation globally, you'll see that stem cells is the biggest topic in the medical industry all around the world. That people are experiencing miraculous changes and differences, and it's relatively new, but yeah, you deserve to give yourself that chance and try it. I mean, what have you got to lose?
Yeah, and for example, there's patients that they don't know about stem cells, for sure, because it's a topic that there's not that common. You cannot look at internet like, oh, stem cell therapy from mesenchymal cord blood. There's not that common to find internet. So most of the patients, they have heard and they search it, right, like a place. But they're patients, they're people that they're not feeling well. They want to improve their quality of life, and they don't know what to do. What you can tell them.
Well, I mean, I'm just telling you the same thing. You just got to get up and make a move.
Yeah.
I mean, nothing's going to happen unless you happen. If you don't get up and move, you're not going to move. And so, you can sit there and hope for something, but if you don't get up and move, nothing's going to work for you. So you could hope in surgery, you could hope in all that stuff, but if you don't get the surgery, nothing happens. So when you hear about something like this, like what we're talking about, you just have to get up and make the appointment, make the arrangement, get here and get this thing done, because I promise you, you'll be super happy and glad that you did.
At what age you will like to start getting your stem cells?
Okay. Well, that's a good question, because if you go back to 2013 with me, I actually had arthroscopic surgery on both of my shoulders. No tissue surgery, but just there was calcium deposits and bone spurs and stuff like that inside my shoulder. So that's when I first started to realize, hey, I got some problems coming here. And so I had that surgery, and that was good for a little while, but that's when I started to discover, like, I couldn't even reach over here and pick up this cup.
Your limitations, the service limitations.
Yeah, and so when I went back to the orthopedic said I wasn't a real good candidate for shoulder replacement, which I didn't want to do that. He said, because you have more range of motion than most people that we do the surgery on, but I was having all that pain and movement restriction. And that's when I started really thinking about it, like, what am I going to do? So I went to a couple different therapists, and I had Prolo therapy, where they inject a solution into your joints and stuff, and then they have cortisone shots. But I didn't want to do that, because all that does is make it numb, so you don't feel anything, and you just keep damaging it by moving it. So that's how I got on the trail of stem cells. The lady that gave me the prolotherapy said, you're really a candidate for stem cells, but you're not going to get it in the United States. And that's how I got on the trail for that. But that started in 2013.
Yeah. So, what age do you recommend to other people start getting stem cells?
Well, I mean, I would, if you're having issues, get it now. I've got a friend who is he's 43 4 years old, and he had a serious injury in his ankle. You know, they haven't been able to do a whole lot for him, so he's getting ready to come and get some stem cell therapy in there. All the ligaments were torn and shredded and stuff like that, but it doesn't matter if you've got injuries or if you've got just older age stuff wearing out. Stem cells is good for every side of the spectrum.
Sure.
So whether you're older or younger, it's a great therapy.
Yeah, I have heard many people say like, "Oh, you know, I'm 60 years old, and I'm feeling better than when I was 40, right? Hey, what are you doing now? I'm doing a lot of exercise, pills, blah blah blah." And they say, "Oh, I don't need that because that's for old people." And we're thinking like, okay, you're right, you're really healthy and everything, but systems suddenly they drop you off, right?
That's right. That's right.
So you can feel really good when you're 60, 70, 40, 45, 50.
Yeah.
But suddenly we have seen many patients like that. They get their first touch and then hey, please help me out, you know, I'm feeling really bad. But systems, the body is a system, and you're feeling amazing in your 60s and your 50s.
Yeah.
You're like getting your second.
I felt that way.
Yeah. You can get your feeling, you're getting your second prime, and suddenly, boom, it blows up.
I was killing it when I was 61 in the gym, just rocking it, and then that's when all of a sudden this stuff started happening later, you know. So I'm glad, because now, like I said, I'm 75 and I'm I can
so well, in my experience, you know, as my position, they have like I can have a comparison, right, from people that they make their first call, you know, that's for old guys, I don't need it, okay, and then they call back and everything. We can tell you, like, you are in between your 45s and 60, and you're feeling that you're having your second prime, your second, you know, boost, without taking anything, just exercise and pills. That's the perfect moment to get your stem cells and keep your second prime for longer. No?
It's this is a true analogy. If you go to estheticians or people that do Botox therapy, they will tell you that it's better if you come when you're younger and get Botox, because you don't develop the wrinkles and stuff anyway.
Yeah, it's prevention is cheaper than correction. That's really true.
Yeah, prevention, and so to do stem cells when you're younger is a preventative measure.
You avoid problems. In my case, me as a CEO, you know, I'm 26 years old. I'm young, but I started getting stem cells last year when I was 25.
Yeah.
Because my family has, my grandma had diabetes, my aunts had diabetes, so I have a diabetes family, right? So suddenly I was going to get diabetes, right? But right now, I'm getting stem cells and I'm trying to avoid that illness, right? So I can tell you, like, in the case of my mom has her blood sugar over 100. She was doing diet, she was doing exercise, she's a fit lady, and you know, she was worried because she never got her blood sugar below 100, and she has no diabetes, you know. But right now she got 1 stem cells per year, and she's having her sugar in 80. So she's really happy because now she's not doing a lot of diet that she was doing before, and her blood sugar is even better because the stem cells and exosomes regenerates her pancreas.
Yeah, it's perfect.
In my case, the same thing, right? I'm younger, so I do it once a year. You know, not that much stem cells, like maybe 15, but people like you they need 100 because the problem is a lot. If you are young, maybe 50 millions or 60 million will be enough, but if you can get 100 million stem cells, it's even better. Why? Because they will last a year in you, right?
Yeah.
And they will keep growing and growing and growing. And
and like I said, they regenerate. So, so a lot of the damage that was done is repaired. So,
and one important point to mention is, for example, why it's important to avoid alcohol, right, or marijuana, or edibles. This kind of or ibuprofen. People is addicted to ibuprofen. So why it's important to avoid these medications and these substances? Well, first, all this marijuana, ibuprofen, Tylenol, edibles, they hide the inflammation. They will not correct the inflammation, right? And the alcohol, they will cause you inflammation when you
Right.
don't have inflammation. So when you have a problem, you produce inflammation. So how stem cells work? Well, first the exosomes will be introduced in your IV for 5 minutes. They will spread out really slow, so they will go and find inflammation. So they work with inflammation. So they will park when they have inflammation. For example, your case was many places, right? For example, patients with
I was inflamed
everything.
everywhere.
Yeah, exactly. So
And it's interesting that you say that because when I got back to North Carolina, I go to a massage therapist, and she said, like, I felt different everywhere, and she said you have like zero inflammation, and that has been that way ever since I came here.
true.
But before I was completely inflamed, so
Yeah. So yeah, like I was mentioned, they work with inflammation. So when the exon will park in inflammation, for you have a kidney problem, they will park in the kidney because when you have kidney problem, your kidneys are really inflamed, and they will park there. When you have diabetes, that's just not your pancreas. Your liver will start failing. Your everything is will start failing, and when you have also diabetes, everything start failing. So everything start producing inflammation. So we will park. This exon will park when you have your diabetes, like the pancreas, and also they will park in other organs that they have been affected,
yeah.
like for the liver, the lungs, everything is affected by diabetes. So
And that's why they say that inflammation is the gateway for disease.
exactly, yes. And then once your exosomes are part in the inflammation, the stem cells will get into your body and they will arrive where the exosomes are, and they were still regenerating. So the exosome will just disinflammate and the stem cell will regenerate. That's why
Yeah.
our protocol from Phorma Medical is really effective, because we do everything to prepare your body to get the inflammation areas and to regenerate. And we will not get you any anti-inflammatory medication. We will not put you like ketorolac or
Yeah.
ibuprofen or
You don't need
no,
it.
you will not pain. We will not get you painkillers or anti-inflammatory, because there are many places that they get you an anti-inflammatory shot or a cortisone shot. We will never put you nothing like that,
Yeah.
because it has contraindication of the own stem cells. You put it with stem cells, the stem cells will not work because they will make inflammation in another area or they will hide the inflammation. So if you have a kidney problem and you get marijuana and or alcohol or ibuprofen, they will hide the inflammation in your
Yeah.
kidneys, and they
No,
will not park there.
yeah, it masks it so that you never really deal with it. So
Exactly.
um,
So that's sacrifice to do 5 days prior and 1 month after the procedure.
yeah.
So John, how was your experience getting stem cells in Tijuana?
Well, like I said, I've been to Tijuana I think 4 or 5 times now with you and Phorma Medical, and it's a seamless experience. I've never had a hitch. And I feel better, I look better, and I am better. And just like I said, I encourage everybody to give this a shot. No pun intended, but you really need to get this done if you're experiencing all that stuff that we've been talking about this afternoon.
What you can say to American citizens, they're planning to get some stem cells in Tijuana or in the world.
Yeah. Well, if you're an American citizen and you want to come to Tijuana, or you're thinking about coming to Tijuana, it's really a seamless process. You fly into San Diego, you're 20 minutes from Tijuana, you get great transportation there. Again, the people are friendly. I haven't seen anything that bothered me or scared me. I mean, I heard all sorts of stuff, before I came here, but it's just all hogwash. And you'll just have a great experience here, like I did. I mean, it was great, and I will be honest with you. I think the reason why I had that great experience is because I did it with Phorma Medical, and with you, because a couple of the guys I tried to talk to before just did not work at all. So I mean, it's like anything else. You can have whatever you do for a living, if you have a lawyer, you can have a bad lawyer or you can have a great lawyer, and Phorma Medical is a great company, and they're just honest and good, and everything is great with them, and they cover all the bases.
Thank you, John.